Let's talk science now. Dr. Adri Kok, a specialist physician and the president of the International Society of Internal Medicine and the Faculty of Consulting Physicians in South Africa, says there is no scientific evidence smoking causes or spreads COVID-19. She says the virus is more likely to be spread if smokers share cigarettes with each other. Dr. Adri Kok joins us to discuss this further. Great to have you, Doctor. Thanks so much for joining us.
Thank you very much. Yeah, I think we need to just qualify that. If you're standing together in a group smoking, of course, exhaling, there is a risk of droplet spread.
Yes.
So, all doctors would want people to stop smoking in any case. So,
of course.
But there's no specific association with COVID.
Okay, so smoking has always been something we know that you do, knowing that it is not good for your health and your lungs, but bringing smoking and COVID-19 into the same conversation, I suppose that's what we need to look at. So let's begin with this contentious issue of smoking before moving on to the other symptoms. What is the likelihood of a smoker being more susceptible to contracting COVID-19?
So we've seen that in South Africa, at least, also the majority of people that have passed away have had one comorbidity, and we don't know exactly how that is differentiated, whether it's heart disease, diabetes, or lung disease, and cancer patients particularly at risk. But of course, because of the way smoking can affect the lungs, the risk is always there that you're more susceptible to virus infections.
Yeah.
And of course, COVID being such an aggressive virus, this is important to consider.
So weakened lungs, obviously, this is a reality. The minute you are a smoker, your lungs are perhaps not as strong as a non-smoker. The likelihood of you not being able to fight coronavirus and obviously succumb to death, is this something that is a reality?
Yes, I think it's really important to consider. Many smokers actually don't understand how badly or not their lungs are affected. And it's oftentimes when we do a lung function test and we can pick up how the lungs are damaged already, the person may be completely oblivious to that. But we do see that smokers contract viral infections more readily. And of course, with the COVID epidemic or pandemic, this is a real concern.
I'm reading a couple of different articles coming out about science and smoking, and one specifically saying COVID-19 enters cells by attaching to the ACE2 receptor. And what it's saying is that due to this, smoking increases the number of receptors in the lung, making it easier for the virus to attach and to make people sick. This science?
Yeah. Sorry?
Are you in agreement with this?
Yeah, so the ACE2 receptors is really the entry point of the virus into the body. The fact that smoking can increase the number of receptors, I'm not sure about. But that the smoke, if you look at your little blood vessels, the integrity of the blood vessels depends on the lining, which is called the endothelium. So not to be too technical, but this is what smoking can affect.
Yeah.
And there are other factors as well, like cholesterol and high blood pressure and diabetes. And so there is the risk that there's an increased injury to the lung from that point of view, because the virus enters into the body through the lungs.
So this is, again, a big reason that's been given to us is that, people are wanting to buy cigarettes, they're wanting to continue smoking, but from the government's perspective, they are saying, no, you cannot buy cigarettes because this is one of the biggest problems with regard to COVID-19. It makes your fight weaker. Would you, if you sat with government, agree with what they're saying, that you cannot sell cigarettes at a time like this?
Yeah, no, I think one has to understand that there's smokers who physiologically is very addicted to nicotine and they can't just stop. It is difficult. And that's why they access, unfortunately, cigarettes on the black market. It's become almost a joke in a way that they're just paying more for the cigarettes, but they still continue smoking.
Indeed.
That it has stopped some people from smoking, I do think that's been achieved. The difficulty is just that the very addicted smoker, unfortunately, will do so still.
Yeah.
So it's not complete gotten rid of the problem.
And I mean, having a look at, I think what you're making is a very important point, is that, and I think we've been saying that as well on the program for a long time. Smokers, yes, you may have a few that have had no option but to quit, but the majority of smokers are still smoking, and they are not necessarily smoking the legal cigarettes, they're smoking illegal cigarettes. And when you speak to any smoker, they will tell you they are terrible and they make me feel sick by smoking them. These illicit cigarettes and the ones that people are now turning to out of desperation, have you had a chance to look at them, the contents, and how they damage you even more than a normal cigarette would?
It's very difficult. No, I haven't had any personal assessment of these. The difficulty is that often it's the filter, it's the content, you don't know what is mixed in the tobacco. This has always been the problem. At least if I can call it the legal cigarettes, there's a tar content. You know exactly what the person is getting, and you know it is at their own risk. The illegal cigarettes, I'm not sure whether they are just normal cigarettes that's being sold on the black market, or whether it's some manufactured cigarettes somewhere. The difficulty is we simply don't know. But again, some people simply cannot just stop smoking. They have that physiological addiction that is worse than heroin addiction in some people.
Yeah,
people who can stop easily, it's not a problem, but this is the concern.
Yeah, it is a major concern. Now, I want to get to that issue of sharing cigarettes, and we saw Minister Nkosazana Dlamini-Zuma, which has since become a major song about sharing and licking the paper and all of these kind of things. But you know, on a more serious note, I mean, just on an observation from my side, I actually was driving home yesterday and I saw somebody digging through the dustbin trying to find stompies and lighting them and smoking them. Now, you know, whether you roll your own cigarette and share it with somebody, or you're digging in a dustbin finding little stompies to smoke, what are you doing? I mean, is this increasing the risk already? People are not only sharing the cigarette, but they're smoking cigarettes from complete strangers.
The difficulty is that the virus, this COVID-19, stays active on many surfaces for many hours. And this is the difficulty. So you don't know that those stompies that they are picking up could still contain virus. And again, this is the uncertain side where community spread could really be a danger. Yeah. You know, it's desperation, and unfortunately people will do it because they're so addicted. I don't know how you stop that, because unfortunately these patients and people will do whatever they can to get a cigarette. So unfortunately, I don't think anything we say is going to make a difference. And sometimes people don't understand the danger that they place themselves and others around them. It's not just themselves, because they could then spread it to people, especially if they don't do good hand hygiene, etiquette, and wearing masks. So this is a huge concern.
It is a major concern. On another issue, can you explain to us the difference between patients that are asymptomatic versus those with typical respiratory symptoms, and patients also who display signs of a heart attack or a stroke?
Yeah. So the interesting, and this is mainly from the international experience so far, and unfortunately post-mortem examination of why people did pass away from COVID-19, is that some people, especially some young patients, have presented with a thrombosis, a clot. Sometimes in the brain, sometimes in the heart, as the first evidence that they have COVID-19. And when they were tested, they were positive, and they found this clotting risk in these patients. And they may not have had the usual symptoms like the fever, coughing, etc. Some patients present with diarrhea and vomiting. Some people have a lack of smell or taste. So some people just present with confusion, or almost like a delirium, as if they just disorientated. So it's not just the typical cough, shortness of breath. Those are almost there's sort of a group of people that may present like that. But it's important not to miss these other situations. And so, we're on the lookout, and we've warned our general practitioners, because they often see these patients at the first contact, to just be aware, and we almost could be COVID.
Yeah.
especially with the community spread being such a concern at the moment.
Yeah, very interesting, Dr. Kok. Just finally, you also say that post-mortem reports in the study that you were talking to and blood tests show that COVID-19 actually causes blood clots.
Yeah. So if you look at what happens in the lung, this ACE2 receptor notion, a whole group of a messenger system that increases the risk of clotting. And when we see the patient, when they come to the hospital, the more severe cases, we find elevated levels of what indicates that there's clotting going on in the body. So we would put them on blood thinners in that severe case or moderately severe patient. So the risk of clotting is very high. So this endothelium, that vascular lining that I spoke about, the integrity of that is affected, and then that causes little clots in all the organ systems. This is why people get kidney failure, for example. And then the stroke and the thrombosis on the heart is not your typical one from hardening of the arteries. It's actually a clot that forms. So this is a very important aspect. So again, if there's any symptoms, we talk about a heart attack, but we talk about brain attacks. If there's anything unusual, it's really important to gain access to a doctor and get to a professional as quickly as possible, not to delay, because those first few hours are golden.
Dr. Kok, gee whiz, I know I have to end this interview, but these ACE2 receptors, which it's a new word I've learnt and something that I'm hoping South Africans learnt as well. The final question I need to ask you is, what I'm reading as well is that children under 10 years old have less, or those have less receptors, few receptors, which is given as a reason as to why children are less susceptible to the virus. Please help us understand this, and particularly with regard to schools going back as well. From Monday, some classes will be resuming. Children and coronavirus.
So I think the children have really seemed to be more immune, and this seems to be one of the reasons why there hasn't been as many children affected. Because as your lungs mature, of course, these receptors in number. It's also interesting that men have more ACE2 receptors than women do. And if you look at the mortality rate overseas, it's 78 to 80% of the mortalities, the death rate has been in men. And South Africa is seeing this as a risk factor as well in people who have passed away from the COVID-19. So I think, the only way that we can ensure that we are as careful as possible is to educate the children. I think that the teachers will have a job to do this, because they have to be careful with their masks. They have to be careful with hand washing. And of course, proximity, social distancing is going to be crucial. It's not an easy task. I think Mr. Panyaso Lesufi has done a fantastic job in Gauteng so far. Just looking at all the reports of what people are safe, and I'm sure this is also duplicated in other provinces. So, I really hope that we can avoid any risk to our children, but that they need to go back to school, I think, is inevitable.
Dr. Adri Kok, thank you for the fascinating conversation. A specialist physician talking to us about the different symptoms that COVID-19 presents, other respiratory complications, the link of smoking and COVID-19, children going back to school, and many other issues. Thank you very, very much for that enlightening conversation.
Thank you.
We keep focusing on medical after this break. Don't go anywhere.